there are a number of things that in an ideal world you would like to have, and I've been on the phone with many of my colleagues in other states who are in the same position as me, and are weighing all the things at their disposal. And so for those of you at home, what gating criteria means is having the ability to do that contact tracing I just said, having testing available. It's also seeing decreases in your numbers, and a number of other measures that were in that White House report, like influenza-like illness tracking and surveillance. And nobody is going to be, the thing that is subtle in this is they're probably, when we did these orders to close down, we did it on a dime, and it was a miracle what we did, especially in the Midwest here. We really, really flattened that curve, and it was kind of a blunt, not surgical instrument. What we're going to be doing in the days to come is going much more nuanced. We're going to be a little more subtle in what we do. There could be things within our existing, because the things that we've done are still components of it. But for instance, are there some things like a mammogram? I'm going to use that as an example. Are there anything we could do that would allow us to do maybe some preventive healthcare that doesn't use PPE? And that could be done masked and socially distanced. And so we're going to layer by layer go very nuanced into, is there anything that we feel safe at moving forward on? And those will be the first things to happen if you think about it. And we won't rush, because it would be very dangerous for us to rush. And that's why we have this amazing team of minds. We didn't have none of this existed when it happened. It was over a 2-week period, but now we have the time to be super thoughtful and maximize everything, whether it's testing or any of the other gating things. But you're right, even the president's plan said, you have to be really cautious. It would be a very false narrative in this country and a very dangerous narrative to just throw the doors wide open and give people a sense that you can just go backwards to normal. That's unfortunately not a part of our reality. But what we're going to do is maximize all we can do with the reality we have.